Hello, welcome to week 4. You are quickly coming up on the midpoint of this course, and actually really are in the midpoint. Hope you're enjoying it. This week we turn our focus to certainly a very popular modality, cognitive behavioral therapy, most often referred to as CBT. And we're going to cover CBT in over this weekend, next week. There are so many really important spin-offs of CBT. We can't cover all of them in the course, but we'll spend time this week on classic sort of core CBT, and then next week look at some important variations on that have come into play around acceptance and commitment therapy and DBT. So this week builds the foundation and the framework for what comes after this. So CBT, probably one of the better known theories for most folks, even lay people who aren't involved or not professional counselors often have some sense of the components of CBT, that the essence being that our thoughts, what we think, affects how we feel, which affects how we behave. And if we want to change how we feel or how our behavior, then CBT would suggest we need to change our thoughts. The classic sort of simplified cognitive restructuring model is the ABC model, which is the activating event occurs, beliefs, we have some kind of an automatic thought in response to that. Oftentimes, this is the hard part of CBT that students and practitioners often undervalue, is identifying those automatic thoughts. It's not as obvious as you might think. And then the C in the ABC model, of course, is the consequence, what happens in terms of how we feel and how we behave. So CBT, not surprisingly, targets the thought part of that, where that chain of events begins. And you'll do well in CBT conversations and anywhere that CBT therapists are gathering. I'm not sure if any such thing happens on a regular basis, but anyway, if you end up in some weekend event and there you are with a bunch of CBT therapists, if you can talk the language of negative automatic thoughts, often referred to as NATs, NATs, then you'll be in the in crowd, in CBT crowd, because this is sort of the essence. This is where CBT focuses all of its effort. So the theory being that we have these automatic thoughts that occur that are actually linked to very deep beliefs, and we're often not aware of it. But those thoughts then influence our feeling, which of course influences our behavior. And as CBT therapists, we spend a lot of time helping people to identify these NATs that occur during stressful or problematic situations, and then we use a process called cognitive restructuring, which involves complex things like schemas, etc. You'll read about this week, to help people replace NATs with, of course, another acronym, PATs, positive automatic thoughts. PATs is what we're looking for. CBT structures, CBT sessions are very structured. This will be one of the more structured therapies that you'll study, as you'll see in contrast when you get into solution-oriented and narrative. They're very different in nature. The CBT therapist is in control. CBT therapist runs the session. Sessions follow a predictable pattern, starting with a mood check-in, which is very, again, structured, and there's actually a form that this client fills out that scores their mood at that particular moment. There's a review of homework, and the CBT almost always has homework assignments. Then the therapist and the client work on agenda setting. then move into the session itself, processing session content for that week, which is often based on these others, and we'll talk about that in a minute. And then talk about homework again for the coming week, and then do feedback. And so let's look at a couple of these in a little more detail. Agenda setting is an opportunity for the client and the therapist to prioritize issues for this session. And one of the interesting things about CBT is the focus from one session to the next can be completely different. You might be working with a person this week on emotion regulation issues they're having. They're getting triggered around, when they're in groups of more than 3 people, and so you work on that for a couple sessions. They come in this week, you go through priority setting with them, and they share that they're less concerned about the emotion regulation problems they've been having in crowds, and now their main concern is all of a sudden a recurring sense of depression, and they want to focus on the depression. And CBT therapists will make that shift. And so you may work on depression this week and come back next week and go back to emotion regulation or something totally different. The key is that CBT focuses on one issue at a time. And that's due to the actual process, the CBT process, which is called cognitive restructuring, is a very specific, very prescribed process. It's actually somewhat complex, more so than most people think. And it takes a lot of practice to really master that. And it really is only designed to work on one issue at a time. So just know that priorities and focus can change with each new session. In terms of the actual session itself, the therapist will use the mood check-in and homework, feedback that you've talked about at the very beginning of the session as part of then working in this week's actual therapeutic session. Focus on the issue that was identified as highest priority. Sometimes there may be several. The client may say, I'd like to work on this first, and if we get through that, maybe we can then also look at this. So you work at those in sequence and really dig into the cognitive, the schema of what's happening in terms of what's driving the undesired feelings and behaviors, and trying to identify the NAT that lies underneath that occurs just prior to the feeling and behavior. And I'll tell you, it's really, really tricky, because what we tend to do as human beings is we skip over that negative automatic thought, and we go right to interpret it. We interpret it. Like if I have this deep-seated belief that I'm just not a very lovable guy, and I know that's sad, but if that were my belief, and certainly some people have that deep-seated belief, then that's going to generate as a negative automatic thought when I say I meet somebody new and I'm looking at them and I'm going, boy, they're such a great person, but I don't deserve that kind of person. They're not going to have any interest in me. We skip over that, and we create our interpretation of it. We might say, well, people are such a pain. They never, people always push me away. They don't like my style, right? When really what's underneath that is this deeper seated belief, if that makes sense. So the CBT therapist is going to work really hard to help people get to that deeper negative automatic thought, and then use various forms of disputing techniques to decrease the power that negative automatic thought has, and eventually replace it with a PAT. That's what we're working toward. Homework. I can't think of a session when you wouldn't have homework. You usually do. It's an integral part of CBT. Variety of things. Some of the more common things are, thought record, diary cards, ABC, chain analysis, worksheets. These are all. There are tons of worksheets in some of the CBT guidebooks and literature. And if you're doing very much CBT, you'll want to have an array of these available. Thought interruption assignments between sessions, ways for people to catch that NAT just as it's occurring, and then interrupt the cycle so that they don't go to emotion and behavior. Sometimes using buddies, friends, to help reinforce desired behavior. And the big one is in session coming up with replacement, these PATs to replace the NAT, and then practicing that actually in between session. So very structured. Sessions are always closed with the therapist will solicit feedback from the client at the end of the session, which is good practice, as we know from week 1 in the course. And then the therapist will always summarize. Okay, here's my impression, what I've observed this week. Here's where I see you in this process. Here's where I think you're beginning of a breakthrough. Here's where I think you're still sort of holding back. You're not connecting with the negative automatic thought that's driving this particular behavior, and then a review of the assigned homework and why it's important to help continue to move forward, and then of course a really clear ending of the session. So very, very structured and a very clear role for the therapist. So this week you'll have a chance to dig more into this and learn how to explain CBT to prospective clients, which I think is important with any therapy any intervention approach we choose to use. Learn the steps involved in cognitive restructuring and apply these core CBT skills in clinical practice. So I hope you enjoy, and I will look forward to seeing you back again next week for the week 5 brief lecture. Take care.